Today we're going to talk about cardiovascular disease. So let's get the facts about cardiovascular disease first. It is the leading cause of death for both men and women in the United States. It encompasses a broad range of conditions and diseases, some of which are said to be genetic, and many of which are the result of lifestyle choices. Please note that our therapies have been able to help and even reverse numerous diagnosed genetic conditions and some cardiovascular genetic disorders. They have been some of the more easily and rapid recoveries that we've worked with. I think it is better to start with what is called gas exchange, which is the delivery of oxygen from the lungs to the bloodstream and the elimination of carbon dioxide from the bloodstream to the lungs. Before we watch a short video describing this, please note that a typical oximeter reads the saturation percentage of oxygen in the blood, which is said to have only a 2-point positive or negative average range of accuracy. If the meter reads a good saturation level, it still does not actually mean that your red blood cells are saturated. We find that a far more accurate reading is accomplished through a live blood sample to see the detailed saturation level of your RBCs or red blood cells. So let's look at this gas video.
Air first enters the body through the mouth or nose and quickly moves to the pharynx or throat. From there, the air passes through the larynx or voice box and enters the trachea. The trachea is a strong tube that contains rings of cartilage that prevent it from collapsing. Within the lungs, the trachea branches into a left and right bronchus, which further divide into smaller and smaller branches called bronchioles. The smallest bronchioles end in tiny air sacs called alveoli, which inflate during inhalation and deflate during exhalation. Gas exchange is the delivery of oxygen from the lungs to the bloodstream and the elimination of carbon dioxide from the bloodstream to the lungs. It occurs in the lungs between the alveoli and a network of tiny blood vessels called capillaries, which are located in the walls of the alveoli. Here, you see red blood cells traveling through the capillaries. The walls of the alveoli actually share a membrane with the capillaries. That's how close they are. This makes it possible for oxygen and carbon dioxide to diffuse or move freely between the respiratory system and the bloodstream. Oxygen molecules attach to red blood cells, which travel back to the heart. At the same time, the carbon dioxide molecules in the alveoli are blown out of the body with the next exhalation. Gas exchange allows the body to replenish the oxygen and eliminate the carbon dioxide, both of which are necessary for survival.
So I hope that was helpful. Now some basics. The heart has two sides. The right side pumps the blood to the lungs to receive oxygen and get rid of carbon dioxide. The left side pumps oxygen-rich blood to the body. Blood flows out of the heart through the arteries, which branch out and get smaller and smaller as they go into the tissues of the body. In the tissues, they become tiny capillaries. Capillaries are where the blood gives up or delivers oxygen nutrients to the tissues and receives carbon dioxide and waste back from the tissues. Then the vessels begin to collect together into larger and larger veins, which return blood back to the heart to begin the whole cycle all over again. So let me give you a little video explanation of that one.
The heart is a 4-chambered organ with 4 main vessels, which either bring blood to or carry blood away from the heart. The 4 chambers of the heart are the right atrium, the right ventricle, the left atrium, and the left ventricle. The great vessels that you see include the superior and inferior vena cava, which bring blood from the body to the right atrium. The pulmonary artery, which transports blood from the right ventricle to the lungs, and the aorta, the body's largest artery, which transports oxygen-rich blood from the left ventricle to the rest of the body. If we remove some of the tough fibrous coating of the heart and great vessels, you can get a better look at the heart beating. you look carefully, you can see a series of one-way valves that keep the blood flowing in one direction. If we inject dye into the superior vena cava, you can watch it pass through the heart as it goes through the cardiac cycle. The blood first enters the heart into the right atrium. A contraction of the right atrium then forces blood through the tricuspid valve and into the right ventricle. When the right ventricle contracts, the muscular force pushes blood through the pulmonary semilunar valve into the pulmonary artery. The blood then travels to the lungs where it receives oxygen. Next, it drains out of the lungs via the pulmonary veins and travels to the left atrium. From the left atrium, the blood is forced through the bicuspid valve into the critically important left ventricle. The left ventricle is the major muscular pump that sends the blood out to the body systems. When the left ventricle contracts, it forces the blood through the aortic semilunar valves and into the aorta. From here, the aorta and its branches carry blood to all the tissues of the body.
Now, common types of heart and vascular diseases involve many different types of diseases that can affect the heart and vascular system, such as coronary artery disease, or CAD. This disease involves arteriosclerosis, hardening and narrowing of the coronary arteries, producing blockages in the vessels that carry blood to the heart. Arteriosclerosis happens over time, slowly blocking arteries and eventually restricting or totally blocking blood flow to the heart. It is usually the cause of heart attacks, strokes, peripheral vascular disease. Heart attack, also called myocardial infarction, happens when blood flow to the heart is severely reduced or cut off due to the hardening and narrowing of the coronary arteries from the buildup of fat, cholesterol, and other substances known collectively as plaque. A blood clot forms around the plaque, blocking blood flow. This results in permanent damage or death of the part of the heart muscle. Arrhythmia is a condition referring to any change in normal sequence of the heartbeat. It involves the electrical impulses of the heart, not the arteries or blockages. These electrical impulses may happen too fast or too slow or irregular, which causes the heart to beat the same way. When the heart doesn't beat normally, it can't pump blood effectively to the lungs, brain, and other organs, causing them to potentially shut down or become damaged. Heart failure. While it is a serious condition, heart failure does not mean that the heart is no longer working. Heart failure is when the heart's ability to pump is weaker than normal. Blood moves through the heart and the body at a slower rate. Pressure increases in the heart, and the heart cannot supply enough blood and oxygen to the tissues, resulting in fatigue and shortness of breath. Congenital heart defect is different than any other types of heart conditions. Congenital heart defects are present at birth. These defects are not disease, but rather an abnormality that occurs while a fetus is developing. Examples of these genetic disorders include a leaky heart valve or malformation in the walls that separate the heart chambers, or holes in the heart. Some heart defects may produce symptoms at birth or during childhood, while others are not discovered until a person is an adult. Treatment may not be needed depending on the severity of the defect. These are issues that are a specialty of TKM therapy. For example, we've treated several cases of holes in the heart, usually infants, and as much as 5 holes in the heart that was resolved in 3 months, verified by cardiologists. So please remember, I'm not providing these lectures for general education only. It is to let the people know there is effective help available. especially when other resources are not offering truly effective help or reversal. So, moving on. Cardiomyopathy is a progressive disease that causes the heart to become abnormally enlarged, have thick walls, and are stiffened. Cardiomyopathy, also known as heart muscle disease, limits the heart muscle's ability to pump blood effectively, which often leads to other heart conditions such as heart failure or arrhythmia. Now, peripheral artery disease occurs when fat and cholesterol deposits or plaque build up in the peripheral arteries, which are the blood vessels outside the heart. This buildup, also called arteriosclerosis, narrows the artery walls, restricting the amount of blood flow to the body's tissues. Depending on the arteries where the blockage occurs, this can lead to stroke, heart attack, renal or kidney artery disease, and other serious conditions. While there is a wide range of heart and vascular conditions associated with cardiovascular disease, there are some general risk and warning signs to watch out for. If you suspect you have a heart condition, it is very important to talk with your primary care doctor for diagnostic tests and screenings. Then you can contact us for separate and sometimes more specific analysis, and especially for treatment that is non-invasive and is shown to be effective for the entire system versus possible symptomatic relief or temporary relief from standard treatments. Well, we'll talk more about this subject later. Now let's break down this a little bit and talk plain about procedures and what is involved, and especially choices. Coronary artery disease and peripheral artery disease both deal with an accumulation of constricting debris in the blood vessels that restricts and eventually blocks blood circulation. Now, this can be from a number of different things, which we'll talk about. This is caused by lifestyle choices, and a big part is diet. If you're not a child, you already have restricted blood flow. Decreased blood flow can start at an early age depending on largely your diet and genetics. Although when your body is 20, 30 years, 40 years old, then it is simply common sense that after several decades of constant use on the average diet and nothing has been done to renew or clean the blood vessels in the heart and body, then an accumulation has reached a point of constricting circulation to an average or severe degree. This can be compounded by other lifestyle impacts on the system, like work environment, daily activities, or lack of activity, overeating and not eating enough raw vegetables, plus consuming food like heated oils. And they're very common factors, especially in the South, but all across the country. But stress, especially chronic stress, has become one of the largest contributors to cardiovascular disease today. Chronic stress or constant stress experienced over a prolonged period of time can contribute to long-term problems for heart and blood vessels. The consistent and ongoing increase in heart rate, elevated levels of stress, hormones, and blood pressure can take a serious toll on the body. High blood pressure and cholesterol levels, smoking, physical inactivity, and overeating definitely increase your risk. Your body releases adrenaline, a hormone that temporarily causes your breathing and heart rate to speed up, and your heart pressure, your blood pressure to rise, resulting in overall stress throughout the system. Such stress, also called cortisol production, and the hormonal chaos can result in an extra belly fat. Very common. Belly fat has shown to contain more than 4 times the cortisol versus other tissues in the body, which is a stress to your heart. Aging changes. The heart itself, The heart has a natural pacemaker system controlling the heartbeat. As the vessels increase, fibrous tissue and fat deposits, the natural pacemaker, called the SA node, loses some of its cells. These changes commonly result in a slower heart rate, a slight increase in the size of the heart, especially the left ventricle. It's not uncommon. The heart walls thickens, so the amount of blood the chamber can hold may actually decrease despite the increased heart size. Hence, the heart fills more slowly. Heart changes cause the ECG of a normal, healthy older person to be a little different than that of a healthy younger adult. Abnormal rhythms or arrhythmias, such as atrial fibrillation, are common as we age and can be caused by heart disease. Normal changes include deposits of the aging pigment. Lipofuscin, heart muscle cells, degenerate slightly. The heart valves, which control the direction of blood flow, thicken and become stiffer. A heart murmur caused by a valve stiffness also becomes common as we age. Let's talk about blood vessels. Receptors called baroreceptors monitor the blood pressure and make changes to maintain a fairly consistent blood pressure when a person changes positions or doing other activities. The baroreceptors become less sensitive with aging. This helps explain why many older adults have orthostatic hypotension, resulting in blood pressure falling when a person goes from lying or sitting to standing. Dizziness results due to less blood flow to the brain. Also, capillary walls thicken, causing a slower rate of exchange of nutrients and waste. The main artery from the heart becomes thicker, stiffer, and less flexible, usually related to changes in the connective tissue of the blood vessel wall, which makes blood pressure higher and the heart work harder, often leading to thickening of the heart muscle, called hypertrophy. Other arteries also thicken and stiffen. In general, most people aging have a moderate increase in blood pressure. Remember that the narrowing of arteries due to buildup on vessel walls adds to this disorder. The blood itself also changes slightly with age. Common aging causes a reduction in total body water percentage, resulting in less fluid in the bloodstream, so blood volume decreases. The speed with which red blood cells are produced in response to stress or illness is reduced, creating a slower response to blood loss and anemia. Most white blood cells maintain their levels, although certain white blood cells vital to immunity, especially neutrophils, decrease in number and ability to fight off bacteria, which increases the risk of infection. Common effects of these changes: normally the heart continues to pump an amount of blood to supply all parts of the body. However, an older heart may not pump blood as well when making it work harder. Some things that make a heart work harder are certain medicines, emotional stress, physical exertion, illness, infections, and injuries. Common problems are angina, which is chest pain caused by temporarily reduced blood flow to the heart muscle, shortness of breath with exertion, and heart attack can result from coronary artery disease. Abnormal heart rhythms, arrhythmias of various types, and anemia possibly related to malnutrition, chronic infections, blood loss from the gastrointestinal tract, or from a complication from other diseases or medicines. Very common. Arteriosclerosis, which is hardening of the arteries, is very common. Congestive heart failure is also very common in older adults. For people 75 or older, congestive heart failure occurs 10 times more often if you don't take care of yourself. And that's a primary reason we're doing these lectures. Coronary artery disease is fairly common, often a result of arteriosclerosis. So one of the things we want to do is clean it up ahead of time. High blood pressure and orthostatic hypotension are very common with age. It is said that adults on blood pressure medication need to work with their doctors to find the best way to manage their high blood pressure, because too much medicine can cause low blood pressure and could lead to a fall and injury. Heart valve disease are too common. Aortic stenosis, or the narrowing of the aortic valve, is the most common valve disease in older adults. Transient ischemic attacks, or TIAs, or strokes, can occur if blood flow to the brain is disrupted. Additional problems with the heart and blood vessels include blood clots, deep vein thrombosis, thrombophlebitis, peripheral vascular disease, resulting in intermediate pain in the legs and walking. Pain in the legs while you're walking. And varicose veins, to name a few. Aneurysms, which can develop in one of the major arteries from the heart or in the brain. Aneurysms are an abnormal widening or ballooning of a section of an artery due to weakness in the wall of the blood vessel. If an aneurysm bursts, it results in bleeding and often death quickly. Let's talk about prevention. You can help all of these issues and decrease risk factors in which you have some control over, like high blood pressure, cholesterol levels, diabetes, obesity, and smoking. Eat a heart-healthy diet with reduced amounts of saturated fat and cholesterol, and control your weight. Follow your qualified healthcare provider's recommendations for treating high blood pressure, high cholesterol, or diabetes. Stop smoking. Remember, e-cigarettes are 100 times more likely to cause cancer than regular cigarettes. Men between 65 to 75 who smoked in the past should be screened for aneurysms in their abdominal aorta. Get more exercise regularly. I emphasize regularly. Exercise helps prevent obesity and helps those with diabetes control blood sugar. Proper exercise helps to maintain your abilities as much as possible and is vital to reduce stress. Stress, as you know, is a killer. Moderate exercise is one of the best things you can do to keep your heart and the rest of your body healthy. Start exercise moderately and within your capabilities, but do it regularly. What is that? At least 4 days every week. People who often exercise have less body fat than those who don't exercise regularly. They also tend to have fewer blood pressure problems and less heart disease and other benefits. Most doctors agree that trans fats, sugars, medications are the main cause for cardiovascular disease. Note this, in the 1900s, this was not a real issue. But now, mostly due to diet and lifestyle, 50% of the population dies from cardiovascular disease. It is the #1 cause of death. A very sobering fact. Let's talk about what the latest standard procedures offer, and then we'll talk more. Like the success of heart bypass surgery. Note, this type of surgery is only for certain patients with one or more blocked arteries, and the long-term results are unclear, according to most studies. Although, most recent study discovered something happens 10 years after heart bypass surgery. people suddenly face a dramatic increase of risk of dying. I'm sure you were not told about that. That's not good. This surprising observation emerged from a study of health registries that Denmark keeps a record of on all its citizens. It revealed people that do very well for 8 to 10 years, then their risk of dying goes up 60 to 80%. Why? Researchers believe it is due to the fact that the disease is progressive, and the arteriosclerosis, or hardening of arteries, simply continues to increase. To me, that's a duh factor. That's common sense. They agree it could also be that the implanted material begins to fail. That's also a duh factor. It does. The average is around 10 years. Both are found to be true. The no-brainer here is that the disease continues because nothing has been done to stop or reverse it. As for the material breaking down and failing, this is common knowledge, although not often discussed, especially to patients. This study didn't really need to happen. It is just a matter of using simple common sense. Was everything done to keep the disease from progressing? No. Then what do you expect? Seriously. But moving on. The current success rate for bypass surgery is said to be 95 to 98%, which means at least 2 to 5% of all patients have complications, including death. The latest research shows up to 50% of patients that currently receive a coronary bypass actually have another blockage of the very same artery within 6 months. I think perhaps this is an indication of a serious flaw. What do you think? Additionally, studies revealed that it is the highest percent of success in cardiovascular surgeries. In the face of those facts. However, vein grafts have shown up to 40% may be closed in just 1 year after surgery. Longer studies up to 10 years after surgery or bypass reveal around 40 to 50% of vein grafts will be blocked again. The most recent reports, the average cost of procedures like plaque removal from the artery, $30,588. Heart bypass cost over $117,000. A heart valve replacement cost over $164,000. Open heart surgery averages $324,000, while a heart transplant is over $997,000, essentially $1 million. We've talked about many common issues, but there is so much more, like blood clots, varicose veins, spider veins, and even the little red dots you get on the skin. Those dots are ruptured capillaries, an indicator that things are not right. Plus things like Alzheimer's, memory issues, hormones, and much more. All can be due to improper blood circulation. Of course, often other contributing factors exist, but they will relate to blood chemistry, like toxins. Elders often bruise easily, which means hemorrhaging easily. Yes, there is a direct connection to liver function and toxins. But that is a blood filter, and the vessels in the body are bleeding out easily. It all still keeps coming back to the cardiovascular system. A stent is a metal or plastic tube inserted into the lumen of a vessel or duct intended to keep the passageway open, meant as a support, placed temporarily inside a blood vessel, canal, or duct to relieve an obstruction, to open it up. Some doctors say stents last forever if they are made of some sort of metal. Although the latest research reveals that They last an average of 10 years, as I said before. The new heart stents are on the market actually dissolves in an artery in 3 years after being implanted. Remember the cost that I told you about earlier? However great your insurance is, remember the payments that you're making? Think about the co-pays. Think about the things that I hear all the time from patients that they say, well, this is what your doctor says, but we as your insurance carrier won't pay for that part. I'm offering some alternatives. So let's talk about the risk concerning stents. At least 1 to 2% of artery stented patients develop a blood clot at the stent site. I just lost a good friend recently for that same procedure. They were putting a stent in and a clot went to the heart and they died on the table. And I've heard of many others. Never underestimate any invasive procedure. Blood clots can also cause heart attack, stroke, or other serious problems. The risk of blood clots is greatest during the first few months after the stent placement. So, food for thought. Whether it is bypass surgery, a stent, vein or artery grafts, angioplasty, or other local procedures, the question remains, what about the remainder of the cardiovascular system throughout your body that'll help? You've got to help the entire body. Patchwork is not the way to go. These localized needs for intervention are a cry for help that involves a need for your entire system, just to different degrees. That is why, with or without these other standard procedures, the entire system needs proper help. That is our specialty, in a non-invasive, non-toxic, and effective way. Not to mention, very cost-effective. Not to mention, you don't die from any of our procedures, much less you don't even have any negative effects. We have had some calls in the past that asked some questions about general cost. That is a common and usual needed question. And we hold our costs down. Occasionally the response has been, why are you so expensive? We know that they are not realizing what they are saying because the first thought is, in comparison to what? First, nothing in standardized medicine will address your overall system in such an effective way and without repercussions, no matter the cost. In functional or natural medicine, for what we offer here, we are below the comparative resources. No, insurance does not pay for most of what we offer, but insurance doesn't pay all your medical bills either. And don't forget your regular payments that you make. That usually add up to a lot of money. The co-pays and so many other things are often higher than our total fees. Plus, you often find that they are simply not covering your medical doctor's treatment plan. I hear of this sometimes on a weekly, if not daily basis. So sometimes they'll cover part of it, or they won't cover it, or partial. So just keep that in mind. We hear about this frustrating situation all the time. That system is for most so broken. So however you appropriately look at it, you just can't find the same solutions for an equal or better cost. This has been and remains our goal. What? To help to the best of our ability and to hold costs down as much as feasible and still be able to operate. We also know that many people simply cannot afford even small, minor health costs. In such cases, we help all we can and provide ways to educate them so that they can get involved in their own health recovery. We provide a way. If you are interested in any circumstance, just know that the less you are able to afford, the more actively involved in your health care is required. Makes me think of one kind lady that came to us a few years ago, properly diagnosed with a very rare and incurable and fatal diagnosis. Now she is fully recovered. She has been telling people, that need help go to the King Institute and do exactly what they say and pay whatever it costs. People seldom realize the value of health and receiving effective help until afterwards. Bottom line, what is your health worth to you? And what choices you choose to make produce the outcome. We are doing all we can feasibly to assist you in knowledge, the latest technology, education, therapy, and at the lowest affordable rates. The rest is up to you. Our ongoing research, learning, keeping up with the latest technology, and ever-increasing overhead to operate in these times is just part of the reality to provide proper help. We try to hold those down as much as possible. And we truly appreciate your support in all the ways you help make this possible. Plus, it is important to know the role one has, such as we provide testing, counseling, therapy, and advice. But it is up to the individual to daily follow through with what is needed for recovery. I am very aware of people in this country having a very hard time, but are still far more blessed than most in the world. It's all perspective. So, before we move on, just an example. You take some of these standard procedures that I mentioned the cost earlier. We could probably help you, your family, and your entire neighborhood better than what standard things are being offered for the cost of one of those procedures. So now, scurvy. Scurvy? Yes, something most people think is in the past, but it is real and very common today in minor degrees compared to those who bled to death in fairly short periods of time, mostly due to no ascorbic acid or vitamin C. The synthetic ascorbic acid is named after the natural ascorbic acid found in fruits, like oranges. Today, it is not a matter of no vitamin C, but rather an overall deficiency and a lack of quality sources, especially in light of the greater need we have due to the much higher consumption of processed foods, GMO foods, and high chemical toxic levels. Poor activity or exercise level, and many supplements are sadly not natural and very poor quality. Profiteers have flooded the market, and an EPA report this year stated that the average American is exposed to over 15,000 chemicals on a daily basis. Where do you get these chemicals? Where do they go? Right into your cardiovascular system. Then to every system and tissue in your body, including the brain. It doesn't matter whether you inhaled the toxins, ate them, drank them, or touched them. It all goes in to your blood and throughout your body and your tissues. You actually get these toxins from all the daily exposures mentioned. What is angioplasty? So let's go there. When arteries become blocked or narrowed, angioplasty, also called percutaneous coronary intervention or PCI, is considered medically as a minimal invasive procedure that uses a catheter and balloon to open up blocked arteries and reestablish blood flow. So what about the success? Studies show angioplasty is successful in opening coronary arteries in well over 90% of patients. The main risk is said to be that at least 30% to 40% of patients with successful coronary angioplasty will still develop recurrent narrowing of the same site. Angioplasty is said to be relatively safe, but about 200 patients dies after non-emergency angioplasty. Sometimes chest pain can occur during angioplasty because the balloon briefly blocks off the blood supply to the heart. So something to truly understand is that all invasive procedures have common to rare risk. that could result in death. Let's look at some videos and then we'll come back.
Let's take a closer look inside the heart. The yellow objects you see on the left are not nerves. They're actually specialized cardiac muscle cells in the walls of the heart. Their job is to send signals to the rest of the heart muscle and cause a contraction. Together, this group of cells is called the cardiac conduction system. The main components of the cardiac conduction system are the SA node, AV node, bundle of His, bundle branches, and Purkinje fibers. Let's follow a signal through the contraction process. The SA node starts the sequence by causing the atrial muscles to contract. That's why doctors sometimes call it the anatomical pacemaker. From there, the signal travels to the AV node, through the bundle of His, down the bundle branches, and through the Purkinje fibers, causing the ventricles to contract. This signal creates an electrical current that can be seen on a graph called an electrocardiogram, or EKG. Doctors use an EKG as a way of seeing how well the cardiac conduction system works. Any changes to the EKG can mean serious problems. Normal blood pressure is important for proper blood flow to the body's organs and tissues. Each heartbeat forces blood to the rest of the body. Blood pressure moves from high pressure near the heart to low pressure away from the heart. The force of the blood on the walls of the arteries is called blood pressure. Blood pressure depends on many factors, including the amount of blood pumped by the heart. The diameter of the arteries through which blood is pumped is also an important factor. Generally, blood pressure is higher when more blood is pumped by the heart, and the diameter of an artery is narrow. Blood pressure is measured both as the heart contracts, which is called systole, and as it relaxes, which is called diastole. Systolic blood pressure is measured when the heart ventricles contract. Diastolic blood pressure is measured when the heart ventricles relax. A systolic blood pressure of 115 millimeters of mercury is considered in the range of normal blood pressures, as is a diastolic pressure of 70. In common terms, this normal measurement would be stated as 115/70. Stressful situations can result in a temporary increase in blood pressure. If an individual were to have a consistent blood pressure reading of 140/90, he would be evaluated for having high blood pressure. If left untreated, high blood pressure can damage important organs, such as the brain and kidneys, as well as lead to a stroke.
Ouch!
Let's examine how platelets work to form clots. Here's a cut section of a small artery. The traffic going by includes red blood cells carrying oxygen, platelets, which come from white blood cell fragments, and clotting factors, which help the blood to clot. When a blood vessel becomes damaged, as shown here, the blood cells and plasma begin oozing out into the surrounding tissue. This begins the clotting process. Platelets immediately begin to adhere to the cut edges of the artery. They release chemicals to attract even more platelets. Eventually, a platelet plug is formed, and the external bleeding stops. Inside, the clotting factors take a much more active role by creating a cascade of clotting activity. The clotting factors cause strands of blood-borne material called fibrin to stick together and seal the inside of the wound. Eventually, the cut blood vessel heals, and the blood clot dissolves after several days. A blood clot or embolus can form and break off from the heart. The clot travels through the bloodstream, where it can lodge in an artery of the brain, blocking the flow of blood. The lack of oxygen results in damage, destruction, or even tissue death of the brain beyond the affected area. The result is a stroke. A stroke can occur when an embolism travels from another part of the body and lodges within an artery in the brain. When an internal arterial wall becomes damaged, various types of emboli can form, such as ones derived from platelets, thrombotic, cholesterol, or mixed. Here, an embolism is formed in the internal carotid artery and breaks loose, traveling towards the brain. The blocked artery deprives the brain of oxygen, damaging the surrounding brain tissue. The result is a stroke.
So we'll go back to some visuals in a moment, but let's talk about some other things. Like, what do? Let's talk about coenzyme Q10, a heart health powerhouse. CoQ10 is an enzyme that the body naturally produces to facilitate important functions including electron transport and blood pressure regulation. CoQ10 is generally taken to support heart health. Many are surprised that CoQ10 actually exists in two main forms with important differences. Conventional CoQ10, technically known as ubiquinone, it is the oxidized version of the nutrient. More than 90% of total CoQ10 in the blood of a healthy young adult is in the ubiquinol form. Before it can do many of the wonderful things people associate with CoQ10, it needs to be converted in our bodies into a more advanced form called ubiquinol CoQ10. Ubiquinol has two specific traits missing from its less advanced cousin: hydrogen molecules and extra electrons. They make a big difference in the nutrient's ability to move through the blood and be absorbed into cells. They also impact antioxidant activity and are a critical role in making cellular energy. The most important organs and muscles, the brain and the heart, require massive amounts of cellular energy to function at an optimal level. This requires CoQ10 in its ubiquinol form. After the age of 30, our bodies have a harder time converting CoQ10 into the ubiquinol form, impacting our body's supply of cellular energy. Inside tiny cellular power plants called mitochondria, ubiquinol uses two electrons in a very specific way to help convert food to a type of fuel called ATP, vitally needed by our bodies. Unfortunately, turning CoQ10 into ubiquinol is not as easy as we age. Omega-3 fatty acids contain essential nutrients important to preventing and managing heart disease. It has also shown to help lower blood pressure, a minimum of 250 to 500 milligrams, combined with EPA and DHA daily. However, higher amounts are recommended for certain health conditions. Bottom line, to date, there is no official recommended daily allowance of omega-3s. We can and should take up to several times as much versus the minimum. Then there's something called astaxanthin, a strong antioxidant for free radicals. Possible side effects, although non-toxic, can include decrease in blood pressure, increase in skin pigmentation, additional hair growth, changes in hormonal balance, lowered calcium levels in the blood, decreased libido. It is in a class of its own concerning antioxidant coverage because it filters into every cell of the body. One study found it was 6,000 times stronger than vitamin C, 8,000 times stronger than CoQ10, 550 times stronger than green tea catechins, and 75 times stronger than alpha lipoic acid. Common benefits are healthier skin, endurance, health with your heart, your cardiovascular system, joint pain, and may play a vital role in cancer treatments. Now let's talk about garlic. It's incredibly nutritious. A 1 ounce serving contains magnesium, vitamin B6, vitamin C, selenium, fiber, and decent amounts of calcium, copper, and potassium, phosphorus, iron, and vitamin B1. Little note there. Many people that mosquitoes are attracted to are deficient in vitamin B1, unless you have blood type O, which makes you, by blood type, more of a target for mosquitoes. Sorry for the sidetrack. It contains, the B1, the garlic contains trace amounts of many nutritional benefits. Garlic contains potent compounds to boost your immune system and combat sickness, including the common cold. It is well known for reducing blood pressure, improves cholesterol levels, and lowering the risk of heart disease. It's just wonderful, should be in everybody's diet unless you have an allergy to it. Extra virgin olive oil. The main fat found in all olive oil is monounsaturated fatty acids, or MUFAs. MUFAs are very healthy dietary fat. MUFAs and PUFAs. That sounds like a cartoon. MUFAs and PUFAs, or polyunsaturated fatty acids, help lower risk of heart disease by improving related risk factors like your blood chemistry. Even the FDA says consuming 2 tablespoons of olive oil daily reduce the risk of disease. It also contains polyphenols, which act as antioxidants, reducing the oxidative stress throughout the body. I recommend a minimum of double the FDA dosage, 2 tablespoons 2 times daily. That's an excellent starting dose. A vital note, heated oils of any kind add to cardiovascular and heart problems and disease. Healthy oils that are not heated actually work the opposite. There's a chemical change. Oils heated over the average of 212 degrees changes the oil's chemistry and makes it toxic, especially concerning cardiovascular disease. Most of us know the important role of proper natural supplementation, although some are still on a witch hunt. When anyone is on a witch hunt, always check for true motivations. What would they gain? How do they benefit from bashing their subject? A recent small example. Listen to this title. Vitamins and supplements may lead to early death. People taking vitamins or supplements are more likely to die over a given period than people not taking them, says a new study from Finland. Do I need to say anything? Okay. They also say this adds credence to a recent study from the US along the same lines. Researchers gathered data on nearly 1,800 people between ages 62 and 74 who participated in a population health study of the residents of one town in Finland. Over a 10-year period, they found that people taking vitamins or supplements were 50 to 70% more likely to die over the course of the study versus those not taking them, says Dr. Tomi Pika of the University of Eastern Finland. Quote, important, get this. This was before factoring in relevant factors. Findings were in line with the study from the University of Minnesota, who looked at 38,000 women who were around the age 62. at the study start and found a slight increase in mortality among those taking vitamins or supplements. So let's look at this closer. For example, 40.8% of 13,000 women taking a daily multivitamin died over the 19-year study, whereas 39.8% of 10,000 women who had not taken a daily multivitamin had died. If you notice, the percent difference was only 1%. Now, starting at age 62 and extending out 19 years makes the age up to 81. That exceeds the average age whether taking multiple vitamins or not. They later made a quote. Both studies showed how a common factor, it was not a cause and effective link. You get that? Taking vitamins, not taking vitamins, they established was not a cause and effect link. The studies showed no cause and effect, but look at the titles and the propaganda statements. So yes, they can reveal the truth if you read into it and you have discerning eyes. So Dr. Tomey also said it could be that people taking supplements tend to have more health problems than non-users. Users, it sounds like drugs, doesn't it? So the non-users, more likely than non-users to have close relatives with health problems. They could have health problems, which could mean they are at greater risk or genetic risk for developing problems. So there's a lot of factors that they did not factor in. Now let's look at it with logic. The vitamins they named were multivitamins, daily multivitamins, most commonly purchased at a grocery store. I've always said that multivitamins generally should not be taken. Most people do not react well to them. Also, grocery store vitamins are usually poor quality and are synthetic. They might have pretty pictures on them, but they're usually synthetic. The worst multivitamins on the market are things like One A Day, Centrum, especially Silver Centrum. They are also the worst at breaking down and becoming absorbable than most vitamins on the market. Many of them do not even dissolve in the body, although they are the largest selling vitamins in America. Another issue is they always include iron. In the majority of studies on food supplements, iron causes more problems than any other food supplement. Guess what? Iron is almost the most common recommended supplement recommended by your medical doctors. Iron is needed for blood and the cardiovascular system. You should get your iron from the food you eat. In my practice, 98% of people do not need, and I do not recommend iron. If an iron deficiency is found medically, they recommend taking iron, and usually very poor absorbable, in other words, non-absorbable sources like oxide. It usually does not resolve the deficiency because they have not addressed why the person is not absorbing it from their food. When I do recommend iron, it is a veggie source iron supplement, usually 1 time per week, and probably with magnesium complex and possibly copper, if they test for it, which is the number one reason why people are not absorbing and especially utilizing iron from food. So I'm not asking you to experiment with this. Don't play with this stuff. Remember, natural food, vitamins, herbs, supplements, that is medicine. It's just natural medicine. The second most potential harmful supplement under iron is copper. It can be toxic to the system and cause a variety of health problems. Yes, I mentioned I may include copper with an appropriate iron supplement, but for 98% of issues, I don't recommend it. I want to be sure you're getting the real point. Although food supplementation has no comparison to synthetic pharmaceutical drugs, which is directly responsible for tens of thousands of deaths each year, according to the FDA, natural supplementation is natural medicine and should be handled as such. Not everyone in the vitamin, mineral, herbal, frequency medicine field is actually knowledgeable enough to prescribe supplementation safely. It is what I call, at best, either a piece of paper from attending a class or a seminar or a degree that does not teach you all you need to know, and you end up providing your learned opinion, or at best, your learned, experienced, professional best guess. Please understand that I'm not here to knock other people in their profession. What's the point? Be wise and careful. And don't think that your neighbor, your friend, your family member, store, or especially what you read online is going to be able to help you properly self-diagnose and effectively treat successfully without risk. So enough on that. It is a gamble, and what's at stake is your health or the health of another. Another way to say health is life. So, there are many other natural supplements to help prevent or treat cardiovascular disease and nutritious foods that are helpful, but you still need professional guidance. I don't want to be known as a source for promoting people to self-diagnose and treat themselves, which I've said is a way of gambling with your health and life. Now, we do have resources for teaching how to self-diagnose and effectively treat yourself in ways that cannot harm or cause any negative side effects. And that's TKM, a method which I've written over 10 books about and developed many teaching DVDs, charts, and added materials to learn from. I do recommend learning about TKM. I wished everybody would. And you can find most of what's needed on our website. But that is not what these free lectures are about. They are to educate on what choices you have and what those choices involve. Because I take choices and consequences very seriously for myself and concerning each of you. Now let's take a look at 3 standardized medical procedures for your cardiovascular system.
DCA, directional coronary atherectomy, like PTCA, is a minimally invasive procedure to remove the blockage from the coronary arteries and allow more blood to flow to the heart muscle and ease the pain caused by blockages. The procedure begins with the doctor injecting some local anesthesia into the groin area and putting a needle into the femoral artery, the blood vessel that runs down the leg. Once the needle is inserted, a guide wire is placed through the needle into the blood vessel. Following this step, the guide wire is left in the blood vessel and the needle is removed. An introducer is then placed over the guide wire, after which the wire is removed. A 35,000th inch guide wire is put in its place. Next, a diagnostic catheter, which is a long, narrow tube, is advanced through the introducer over the 0.035 inch guide wire into the blood vessel. This catheter is then guided to the aorta, and the guide wire is removed. Once the catheter is placed in the opening or ostium of one of the coronary arteries, the doctor injects dye and takes an X-ray. If a treatable blockage is noted, the first catheter is exchanged out over a 0.035 inch guide wire for a guiding catheter, after which the wire is removed. Once the guiding catheter is in place, a 14 thousandths inch guide wire is advanced across the blockage. Then, a catheter designed for lesion cutting is advanced across the blockage site. A low-pressure balloon, which is attached to the catheter adjacent to the cutter, is inflated such that the lesion material is exposed to the cutter. A drive unit located at the proximal end of the catheter is turned on, spinning the cutter. A lever on the drive unit is advanced by the physician, which in turn advances the cutter, cutting away pieces of the blockage. These lesion pieces are stored in a section of the catheter called a nose cone and removed after the intervention is complete. Together with rotation of the catheter, the balloon can be deflated and reinflated to cut the blockage in any direction, allowing for uniform debulking. A device called a stent may be placed. This is a latticed metal scaffold that is placed within the coronary artery to keep the vessel open. After the intervention is completed, the doctor injects contrast media and takes an X-ray to check for any change in the arteries. Following this, the catheter is removed and the procedure is completed. One option to treat the blocked coronary artery is a surgical procedure called coronary artery bypass grafting surgery. The procedure involves taking a section of vein from the leg and grafting it onto a location on the heart, which allows blood to bypass the blocked portion of the coronary artery. The procedure begins with the surgeon making a cut in the leg and removing a section of vein. Both ends of the vein are tied off in the leg, and the cut is closed. The blood circulation in the leg is not compromised because the leg has many other veins which can take over circulation in the area of the removed vein. The surgeon will then divide the sternum, the bone that runs down the middle of the chest, exposing the chest cavity. The heart is then connected to a heart-lung machine, which takes over the work of the heart and lungs during the treatment. Once this is completed, the heart is stopped. The surgeon then locates the blocked coronary artery and attaches the section of vein taken from the leg to the aorta and to the coronary artery below the blocked segment of the artery. The surgeon may do as many bypasses on as many blocked coronary arteries as the patient needs. Once each bypass graft is placed, it is checked for leaks. Following this, the heart is restarted. Once the heart is beating again, the surgeon will remove the links of the heart-lung machine and sew those openings closed. Following this, the chest is closed. The surgeon will leave pacemaker wires in the heart and bring them out to the skin to help control any heart rhythm problems the patient may have. Percutaneous transluminal coronary angioplasty, or PTCA for short, is a minimally invasive procedure to open up blocked coronary arteries, allowing blood to circulate unobstructed to the heart muscle. The procedure begins with the doctor injecting some local anesthesia into the groin area and putting a needle into the femoral artery, the blood vessel that runs down the leg. Once the needle is inserted, a guide wire is placed through the needle into the blood vessel. Following this step, the guide wire is left in the blood vessel and the needle is removed. An introducer is then placed over the guide wire, after which the wire is removed. A 35 thousandth inch guide wire is put in its place. Next, a diagnostic catheter, which is a long narrow tube, is advanced through the introducer over the 0.035 inch guide wire into the blood vessel. This catheter is then guided to the aorta and the guide wire is removed. Once the catheter is placed in the opening or ostium of one of the coronary arteries, the doctor injects dye and takes an X-ray. If a treatable blockage is noted, the first catheter is exchanged out over a 0.035 inch guide wire for a guiding catheter, after which the wire is removed. Once the guiding catheter is in place, a 14 thousandths inch guide wire is advanced across the blockage. Then, a balloon catheter is advanced to the blockage site. The balloon is inflated for a few seconds to compress the blockage against the artery wall. Then the balloon is deflated. The doctor may repeat this a few times, each time pumping up the balloon a little more to widen the passage for the blood to flow through. This treatment may be repeated at each blocked site in the coronary arteries. A device called a stent may be placed. A stent is a latticed metal scaffold that is placed within the coronary artery to keep the vessel open. Once the compression has been performed, contrast media is injected and an X-ray is taken to check for any change in the arteries. Following this, the catheter is removed and the procedure is completed.
I hope those instructional videos were helpful, understanding more about the procedures, and can generate questions if you want to ask those to your physician. So now let's look at a couple of cases. King Institute, Restoring Health Naturally Through Physics. It gives us the greatest understanding to help you. So let's look at these cases. Mandatory quadruple bypass, says the medical doctors, after severe heart attack. A male, age 68, experienced declining cardiovascular health for over 15 years. Already received the stent implanted over 10 years prior, which means it was due to give. Found himself experiencing paralyzing pain during a severe heart attack one night. His wife called 911, and he was soon on his way to the emergency room. I got the call from his wife that morning. After 3 days of repeating tests that were inconsistent, the cardiologist came into the hospital room to explain the conclusion from testing and the needed surgery to help save his life. All 4 arteries of the heart were 90% and up blocked, with one at 99 to 100% blockage. The man thanked the doctor, and once he left the room, he said that he would not allow the surgery. He looked at his family and said, "I'm only going to do what my friend Dr. King suggests." That's a little pressure. You can imagine how his family responded and continued to respond. In other words, they were not in agreement with him. This was a big scare from the cardiologist, and he already had a heart attack. And of course, that weighs a lot of weight on me under the circumstances, but I've been in similar situations many times. So it is a matter of following what works and getting the client to comply. In brief, no medications, no surgery, and totally non-toxic, non-invasive protocol. He was fully recovered in a year, most of which took place fairly rapidly. But in a year, he was in better condition than he had been in 20 to 30 years, and is still going strong now with no cardiovascular difficulties. There are choices, and some are far greater than most people think exist. This is about beyond the hope of medical science. Everything was done. Severe arteriosclerosis. This man was age 63, experienced declining blood circulation, especially in the feet and lower legs, for over 20 years. The condition produced severe pain in his body, greatly decreasing ability for physical activity, extreme atrophy, especially legs. After 3 years of treatment by internist, he was referred to a vascular surgeon and remained under the care of a cardiovascular specialist for 6 years. He was treated for high blood pressure, underwent varied treatments, tests, including surgery to graft a section of the main artery in the right thigh, which is obstructed by arteriosclerosis. After successful graft of the artery, there was increased arteriosclerotic changes spread from the cerebrum to the toes. Extreme arteriosclerosis. 2 arterial operations were performed to relieve severe intimal irregularity in the left leg, which was the better leg. These procedures were also unproductive. The overall condition, 70% plus narrowing of the carotid artery, left and right sides. Remainder of the body was 70 to 90% narrowing. The legs from the groin to the knees had 99 to 100% blockage, and from the knees down, 0, no circulation. The visual exam were severe black discoloration, it was skin on bones, alarming scaling, several layers of skin, inability to walk, no sensation, complete numbness in both legs. This was apparent for years. Toenails had fallen out. It was a critical infection plus 2 large areas of dry gangrene just below the right knee. Severe webbing of toes, layers of dead skin peeling, no evidence of blood, nor sensation when the skin was punctured. Doctors declined further hope. They'd done all that they could. So the advice given by 2 specialists were 2 options. Option 1, amputation of both legs with the understanding that there was little chance of surviving the trauma of the surgery. In other words, they said he would not likely recover from the anesthesia. He would not leave the operating room alive. Option 2, wait for the poison in the legs to overtake him shortly, the gangrene poisoning. They estimated no longer than 2 weeks before death. That's the day that we got the call. He contacted our office, and to make it short, the summary, intense TKM therapy produced immediate response. So this was daily TKM done. The first session, he felt a strange tingle in the legs. He hadn't felt that in years. This encouraged dedication to daily TKM. 3 months later, with only TKM, blood circulation over the entire body greatly improved, and the nervous system regenerated in the legs, except at the surgical site where they had been severed. New toenails grew, fresh, soft, pink, baby translucent-like skin covered the lower extremities, his legs, feet, and toes. The sensitivity, which had not been experienced in years, reemerged. He was able to walk again. Muscle tissue rebuilding in the legs, feet, and under the heel where there was none before. He was restored. This image can occur from frostbite to diabetes or severe arteriosclerosis. The medical solution is amputate. We've seen far worse fully recover. It's interesting. If you can't solve something, just cut it off and throw it away. You know, I understand their point, but it's too easy for society to buy into that. There are solutions. So there was a pastor in the Philippines with similar infection in his big toe that was recovered in several days, which really amounts to 2 days, 3 days was recovery. 2 days was remarkable difference. And these are some examples that you can pause the video and look at different times. So here's a normal, early stages, and you're seeing this mostly from the bottom, how they're illustrating it. From here on is inflammation with calcification. From here on is scar development with calcification. You'll see these other descriptions. But if you have these issues at a location in the body that the medical community identifies, believe me, you've got them in other areas as well. So this is how we're born. Normal? No. That's called excellent. It is not normal. This is like when you're born. This is what you end up with later. So you can see the progressions and what happens. So if you have this somewhere in the body, believe me, you've got it in a lot of other places. And no, there are no cardiologists or surgeries that's going to clean up your whole body. They don't give you any medications or other therapies that clean up your cardiovascular system. So you need proper help, not a temporary Band-Aid, which can also be very high risk. So I want to tell you about some TKM procedures, especially for cardiovascular disease. We sometimes call this a blood recipe. So the primary things, although there are other things, so these are primary. The 5 sequence, 10 sequence, 15 sequence, 23. And if you do the 5, you want to do the 5, 6, 7, 8 sequence as well. If you do the 23, you want to do the combination 23, 25, and the diaphragm sequence. Let me give you some differences because they all have their specialty. So the 23 and the combination are specialties in circulation. So if there's any circulation problems, it's going to help it. If there's any chemistry problems in the blood, it's going to help correct that. If there's holes in the heart or a faulty valve or anything that needs under the understanding of repair, that's the specialty of the diaphragm sequence. And this is primarily for people that already know about TKM. If you don't know about it, I highly suggest it. Whether you have cardiovascular or other issues, you want to learn this for yourself and your family for the rest of your life so you have help within your hands at any time. This is an example. This is unmatched by anything else, not only in this country, but the world, as far as what we know and have been able to search for. It's a great tool. There's several emergency applications here that work consistently. This is not a percentage or is under certain circumstances. They work across the board. Nothing else that I know of stops a heart attack in progress, stops seizures, anaphylaxis, hemorrhaging, internal or external, choking, asthma attacks, even acute appendicitis. It's been consistent each time. The report from the medical doctors that are involved with this and many other people that have had the experience. There are other things that will help. And a lot of these procedures that I'm showing you right here, most of those are single-step procedures that you can now get on your phone. So whether you have an iPhone or some type of Android, all you got to do is go and download TKM app. If you want to go to this website, it's tkmapp.com. Very effective mobile application. The application is free to download. There are several ones that you can use for free, and then the others are like $1.99. So if you don't download this, I don't even understand why you're watching the lecture or anything else. This is something that everybody should have. We put it out there at great expense so that you can have help available at any time you need. We are constantly here working on restoring health naturally through physics, because it is the most extraordinary research that's produced results compared to anything. You can spend billions of dollars in research for standardized medical science, but they have certain parameters that they won't look outside of. We've looked outside of it. So you can contact us at these numbers, and we're available to help you any way we can.